So someone wanted to know about how we can use convergence to tell if something is supranuclear or infranuclear or internuclear. And all of these have different meanings, and you see that they all have nuclear in them. And the nucleus that we're talking about are the ocular motor nuclei, the third nerve nucleus, which lives in the midbrain, and the sixth nerve nucleus for horizontal gaze, which lives in the pons. So when you have horizontal gaze and you're trying to look to one direction or another, in this case we're looking to the left, we have to activate the left lateral rectus, and at the same time we have to activate the right medial rectus muscle. So in order for us to look to the left, we have to have both the third nerve subnucleus for the medial rectus and the ipsilateral sixth nerve subnucleus fire. So the sixth has to talk to this third. And the way he does that is with an interneuron, and that interneuron is called the medial longitudinal fasciculus, MLF. So in order to get both eyes to look to the left sixth nerve nucleus must talk to the left lateral rectus muscle and the contralateral right medial rectus muscle via the interneuron, the medial longitudinal fasciculus. And so if you have a lesion in the MLF, you'll get an internuclear ophthalmoplegia. The two nuclei are 6 and 3, internuclear, between the two nuclei. And the reason convergence can help us make this diagnosis is we have supranuclear input to the third nerve subnucleus. We can talk to the 3 without involving the 6. And that's to get the eyes to converge. That's talking to the medial rectus subnuclei. So if we can make the eye cross in with a convergence effort, that means the supranuclear input to 3 is intact. And so if we have an INO, we can tell if the convergence is intact that the lesion in the MLF is below the midbrain. And it will prove through supranuclear input that the internuclear neuron is out, the MLF, and all the infranuclear pathways are intact. And so convergence can help differentiate using supranuclear that it's internuclear and proving that infranuclear is intact just by having them look at the target in a patient who has an internuclear ophthalmoplegia where they cannot adduct this eye and there's a contralateral dissociated horizontal abducting nystagmus. That thing is called an internuclear ophthalmoplegia, and if you see it, we can differentiate pons from midbrain with convergence.